Sisters and brothers, welcome to your nation's capital.
I think you're going to be on this side, Bernie.
I'm going to be on this side. All right. Well, thank you. Let me thank all of the nurses who are here. Let me thank the doctors who are here. Let me begin by saying you speak for the overwhelming majority of the American people. You know, I do public meetings all over Vermont and all over the country. And I always ask one very simple question, and that is the American healthcare system broken? And that is the answer we get all over the country. And I want to thank Pramila and Debbie for their great work in the House. You have how many co-sponsors now?
Over 100.
Over 100. And we have 16 in the Senate. And the truth is there should be 435 in the House and 100 in the Senate. But the bottom line of this issue, as in many other issues, you don't see it, but there is an invisible bubble here on Capitol Hill. It's high technology, you don't see it. And the voices of the people can't get through that bubble. The only thing that gets through that bubble is the money of wealthy campaign contributors. So today we say loudly and clearly, the function of a rational healthcare system is not to make billions for the insurance companies and the drug companies. It is to provide quality healthcare to every man, woman, and child as a human right. Today in America, and a lot of folks don't know this, we spend twice as much per capita on average as the people of other countries. And yet, despite spending over $14,000 for every man, woman, and child on health care, 85 million of us are uninsured or underinsured. And we have 68,000 people every year who die because they can't get to a doctor on time. Can you imagine that? And I want to mention just something else to show you how cruel this system is. Today, 42% of cancer patients deplete their entire life savings within the first 2 years of their diagnosis. Can you believe that? So here you are coming down with the terrible diagnosis of cancer. You're fighting for your life. And I have talked to those folks, and they're worried about their family going broke. How insane is that? In terms of life expectancy, at the end of the day, we all want to live long, happy, and productive lives, right? That's what it's all about. And yet we live 4 years shorter lives than the people in other wealthy countries, despite all of our expenditures. And working class people, on average, live 7 years, fewer years than the wealthy. Got that? So being working class in this country is in many ways a death sentence. We have the dubious distinction of having by far the highest infant mortality rate of any other wealthy country on earth. And as bad as our overall healthcare system is, our primary healthcare system is even worse. Today, tens of millions of Americans live in communities where they can't find a doctor, they can't find a nurse, they can't find a dentist, they can't find a psychologist, while others have to wait months in order to get into a medical office. That is absurd. So for all of those reasons, for the fact that health care is a human right, for the fact that we waste enormous amounts of money on administration and on profiteering and on advertising, for all of those reasons and more, today, Pramila, Debbie, and I are introducing Medicare for All single-payer legislation. And let me very briefly tell you what this legislation is about. Our legislation would provide comprehensive care to all Americans, rich, poor, young, or old, with zero out-of-pocket expense. It would provide full freedom of choice regarding health care providers. You go to the doctor, the nurse that you want to. No more insurance premiums, no more deductibles, no more co-payments, no more filling out endless forms. No more fighting with the insurance companies to get what you paid for. And comprehensive means comprehensive. It means covering dental care, vision, hearing aids, prescription drugs, and home health care. And you know what else this legislation does? It says to millions of workers in this country, you don't have to stay at a job you don't want to be at just because you have health care at that job. So we have the radical belief that workers at McDonald's deserve the same quality care as executives on Wall Street. Would a Medicare for All healthcare system be expensive? Yes. But while providing comprehensive health care for all, it would be significantly less expensive than our current dysfunctional system. And that is not rhetoric, that is fact. And it would be less expensive because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. In fact, the CBO, Congressional Budget Office, has estimated that Medicare for All would save the American people $650 billion each and every year. In other words, we have the radical idea that you should put health care dollars into health care, not into profiteering or bureaucracy. A simple health care system, which is what we are talking about, substantially reduces administrative costs, but it would also make life a lot easier, not just for patients, but for nurses. How about not having to beg the insurance companies for treatment for your patients? So, brothers and sisters, that is where we are right now. The American people want fundamental change. We're taking on big money interest in the healthcare industry who see the function of their life to profit off of human illness. So let us stand together. Let us do what the American people want. And let us transform this country. And when we pass Medicare for All, it's not only improving health care for all of our people. It's doing something else. It's telling the American people that finally government is listening to them and not just the wealthy campaign contributors. So thank you all very much. And now let me introduce somebody who has been in the forefront in the fight for Medicare for All, Congresswoman Pramila Jayapal.
Thank you so much, Senator Sanders, for your relentless, committed leadership, for making this an issue that the entire country resonates with. Also, want to invite up our other speakers. We have union leaders and speakers who are going to be here. Come on up and stand with us. Thank you so much for being with us. And I want to thank my co-lead, Representative Debbie Dingell, and the already over 100 members of the House of Representatives. I have a feeling that by the time the nurses get done today, we're going to have even more than that. Is that right, nurses? because we know in the richest country in the world, health care should be a fundamental right available to all, not a privilege for the wealthiest few. Now, right now, Republicans and the billionaires that control the White House are working overtime to gut health care. They're working overtime to gut Medicaid, Medicare, Social Security, all so they can give another $5 trillion tax break to the wealthiest in this country. Now, Elon Musk has laid it out very clearly. He has said that Social Security and Medicare are the big ones, the entitlement programs that we need to get rid of. But these are not entitlement programs. These are earned benefits that you all put money into. So hands off our Medicare, our Social Security, and our Medicaid. Now look, here's the thing. It is criminal, absolutely criminal, that in the richest country in the world, 85 million Americans are uninsured or underinsured. In the richest country in the world, 100 million Americans have medical debt totaling $220 billion with a B, dollars. And it is criminal that even as more Americans suffer and die because they can't get the health care they need, the 5 largest private insurance companies had $371 billion in net profits in the last decades, all by denying the claims that Americans are submitting for health care that they need and they deserve. Now, right now, these same private insurance companies, Big Pharma, they're doing everything they can to privatize traditional Medicare through programs like Medicare Disadvantage. That's what I call it, Medicare Disadvantage. Because if we just crack down on the waste, fraud, and abuse of those private insurance companies, we would have more than enough money to provide dental, vision, and hearing care, expand Medicare to do that, and to make sure that we cap out-of-pocket costs. But you don't see Elon Musk's Department of Greed and Ego going after that fraud and abuse, right, Bernie? Look, here's the thing. We have never suffered from scarcity in America. Never. We suffer from greed. And more people are losing health care because of these profiteering corporations. We know we can do better. And that's why Bernie, Debbie, and I, and all of our co-sponsors in the House and the Senate are here to reintroduce Medicare for All, the only bill that provides comprehensive health care, quality health care to every person when you need it, where you need it. No more co-pays. No more private insurance premiums, no more deductibles, no more losing your health care when you lose your job like 27 million Americans did during COVID. No more trading health care for wages at the bargaining table. No more private insurance companies limiting your health care because their corporate paid doctors refuse to give you the treatment that you need and deserve. No more GoFundMe accounts, no more waiting till you're 65 and on Medicare to get the cancer treatment that you deserve. No more ignoring your teeth, eyes, and ears that are part of your body the last time we checked. No more profits before patients. Medicare for All is actually not a radical idea. People call it radical, but it's not radical. When Bernie, when any of us go across the country and talk about this, we talk about the fact that every other developed country in the world has a universal health care system. This is not radical that the richest country in the world should have that as well. And despite all the money that the lobby, the corporate lobby, has put into fighting this idea, Medicare for All is still incredibly popular across the country. 70% of Americans support Medicare for All, and thanks to all of you, we have over 100 state and local governments that have passed resolutions calling for Medicare for all. That is thanks to the advocacy, the activism of this coalition of doctors, of nurses, of students, of leaders across the country, of communities that are saying we deserve this. Now, nothing worth fighting for has ever come easy. You can look at that across the history of our country. And taking on this giant for-profit lobby is going to be a challenge. But we are here to say we're in this to win this. And we are not backing down. We are not backing down because we intend to fight for the healthcare system that everyone deserves. Because our collective organizing power is so much more powerful than their greed. And our vision for a universal healthcare system is gaining even more power every day to defeat the billionaires and the profiteering corporate interests. So today, we are here to introduce Medicare for All so that people across the country know that we are all fighting for everyone's right to live longer and healthier, for a world in which breaking a bone doesn't mean breaking the bank, for Medicare for All, where everyone is in and nobody is out. Thank you all so much, and now let me turn it over to my friend, my co-lead in the House, Congresswoman Debbie Dingell.
Thank you, Pramila, and thank you, Bernie Sanders, who I love being in the fight with on any issue it is. But I believe that with Bernie and Pramila, we are gonna get this done. I'm telling you. I want to thank everybody. I want to thank those, and I want to thank our partnership with the nurses who have always been there and all the advocates for this fight. We all agree here that it's time for the United States to join with every other industrialized nation in the world to guarantee health care as a right for all. A healthcare system that ties coverage to employment will always leave patients vulnerable. We saw this during the COVID-19 pandemic, which exposed, many of us already saw it. We knew where the fractures were, but it exposed what serious fractures we have in our system as millions of Americans lost their jobs, their health coverage, and did not know where to go to help or get help or see a doctor or see a nurse. And that should never happen in the United States of America. Now, it's an outrage, it's not right, and we're fighting it tooth and nail. Tens of thousands of federal employees are being fired. Not laid off, fired. And there may be mass layoffs in the event of, I'm going to try to behave and stay focused on Medicare for all. But they don't have health insurance. I had a woman in my district who worked for the Great Lakes Lab who was in tears with me the next day. She has a medical condition. She got fired the night before. She had no insurance. Her doctor wouldn't see her. She didn't know what she was going to do. And that is not what should happen, should ever happen. And that is why we are here fighting. Too many people, too many families are being forced to choose between getting critical Medicare or putting food on the table. Too many are having to choose whether they can afford their medicine or eat. It's flat out wrong, and Medicare for all will put a stop to it. As Bernie and Pramila have said, we spend twice as much per person as any other industrialized nation in the world. Right. And our outcomes are, we spend twice as much and our outcomes are worse. What the hell does that say about the healthcare system we're living in now? And by the way, that number increased in the last 2 years. We've got worse outcomes, including lower life expectancy. As Bernie said, higher infant mortality rates. The only people, and I mean the only people benefiting And the people who don't want us to improve this system are the corporations profiting while Americans struggle, and it's wrong. Now, I'm going to say something to you. This is personal to me. My family's been fighting this since the 40s. My father-in-law was one of the sponsors of one of the authors of Social Security. And the next thing he did was to introduce universal health care in the 40s. And he never stopped fighting. And John Dingell, the man I loved, introduced this bill every Congress until the day he died. And the day he died, he said, Deborah, get this over the finish line. And I will not let my husband down. And you know, people said to me, why are you doing this? They're Republicans. They'll never let it pass. I'm doing this because we have a lot of voices. And change takes time. But from the 40s to 65, we got Medicare. Then we got the Children's Health CHIPS. Then we got the Affordable Care Act, which, by the way, these bastards want to roll back on people, and we will not let that happen. We are not going to go backwards. We are not going to let that happen. Millions of Americans are frightened about pre-existing conditions, escalating prescription drug costs. And let me tell you, you say we don't have a shortage of drugs? We do have a shortage of drugs. I was mothers with children with asthma, they can't get the inhalers. They can't afford the inhalers. Yesterday, I was with a mother whose daughter has cancer, and doesn't want to eat, and the medicine they prescribe for her isn't available. This is not okay. It's not America, and people who have kids need to be able to get their kids help. I was in an elevator at the University of Michigan Hospital, and a mother had her child in the wheelchair, and she just started crying with me, and she said to me, promise me, if they cut our Medicaid, I'll still be able to get my son help. I said, I promise you, I will not let him not get medical help. And then went to the head of the hospital and said, I just promised him you'd take care of him no matter what. But we shouldn't have to do that. Every mother has a right to have her children be able to go to the doctor when they need to go to the doctor, get the treatment they need and the medicine they need. So we've made progress, but we're not going to stop. We will not stop until every single American is guaranteed health care. It's a basic human right. No, it is a basic. No one person will get this done. I have great teammates, but you are the partners. It'll happen by all of us joining together in a movement to highlight why Medicare for all matters, and we've pushed for that final change in our system. Thank you for all of your work, for being here, and let's go get it done.
Okay, I think now we have the great honor to introduce Bonnie Castillo, the National Nurses United president.
All right, nurses. I see a lot of power here. A lot of power. A lot of power. Hello, everyone. I want to begin by thanking Representative Jayapal, Representative Dingell, and Senator Sanders for fighting to move our Medicare for All bill forward. We need fighters in Congress. So let's give them a big round of applause. It's no secret that as we're here in D.C., we are here at a very particular time in our country's history. It's a moment where, can you hear me? Oh, okay. Okay, is that better? All right. As I said, it's no secret that we're here in D.C. at a very particular time in our country's history. And it's a moment where we all must step up. The current administration and their billionaire buddies are trying to pile endless cuts and attacks on public services, Medicaid, Medicare, Social Security, and they've even tried to wipe away, strip away the protected union rights of federal workers, including 15,000 of our VA nurses. They hope that we'll get stuck fighting just to save protections we've already won and be too demoralized to move forward. Well, guess what? You're looking at it. Registered nurses and our allies don't step back. We step up. Let me hear you say that. We step up. During pandemics, what do? We step up. During climate emergencies, what do? We step up. And yes, during authoritarian regimes, what do? We step up. As patient advocates, nurses, know it is our duty to fight for a system that prioritizes people over profits. So even through the deadliest years of COVID, when we didn't have a moment's rest, nurses have never stopped fighting for Medicare for all, and we never will.
We will not!
Our immoral healthcare system already leaves patients suffering on the best of times. So when we're in the worst of times, we fight harder. For too long, our patients have suffered and died in this profit-driven system, while health care corporations have lined their pockets.
Shame!
In 2025, we are more than tired of billionaires profiting from the suffering of working people. When federal workers endure mass firings, they are also losing their health care coverage for themselves and their families. So again, this moment of crisis, and it is a crisis, only underscores the need for deep systemic change with Medicare for all. We will not give the billionaires the satisfaction of creating division in action in our grassroots movement. We're stepping up for the good of the many, not the profits of the few. We're stepping up for Medicare for all. And when we fight, we win. Again, let me hear you. When we fight, we win. Thank you.
Thank you, Bonnie. Our next speaker is Dr. Sanjeev Sriram, who's a pediatrician and board member of Physicians for a National Health Program. Dr.
Good morning. My name's Sanjeev Sriram. I'm a pediatrician in Maryland and a board member for Physicians for a National Health Program. When I told my friends and family that I was coming here, a lot of them asked the question, is Medicare for all realistic? Like, I know the healthcare system sucks, but is Medicare for all realistic? So let's dig into that. All right. I was born in Bath County, Virginia. All right. My mom gave birth to me at a very small, tiny, rural community hospital where she could not have been born had she been born in the United States. What changed between the time my mom was born and the time she had me? The majority of American hospitals were segregated at the time that Medicare was getting passed. Medicare came and said, we have got to stop segregation in hospitals. But let's be clear, that's not because a bunch of politicians woke up feeling kind and generous. No, that is because we, the people, demanded better. We demanded integrated health care. Everyday people, patients, families, doctors, nurses, got together and said, we will not accept the unacceptable. Business as usual is not realistic. We demanded better. Medicare for all is as realistic as we are willing to demand better. Now, to do this, we're going to have to overcome some really, really tough divides. Because right now we've got the Trump regime, we've got corporate greed machines trying to divide us, manipulate us, get us into thinking about who is deserving, who is undeserving of health care, who is worthy, who is unworthy of health care. And the truth of the matter is health care is a human right, regardless of what you earn, regardless of your employment status, no matter what you look like. Health care is your human right. You live in a blue state, you live in a red state. Health care is your human right. Now, as we build Medicare for all, we need to make sure all means all. That's going to require us to understand that women seeking abortions are people, not problems. My transgender patients seeking gender-affirming care are people, not problems. Immigrants seeking any kind of care at all are people, not problems. All means all. Because after all, if healthcare is not a human right for all of us, it is not a healthcare right for any of us. All must mean all. At Physicians for a National Health Program, we are eager to fight for our patients. We will fight the insurance companies. We will fight Big Pharma. We will fight the deceitful lobbyists. Together, we can overcome our obstacles. We can make healthcare a human right for every single person in this country, regardless of what they earn, where they live, who they love, what they look like. Let's do this.
Thank you, Doctor. Rachel Fox is a medical student and member of Students for a National Health Plan. Rachel?
Hi, everyone. My name is Rachel Fox. I'm a medical student and a health equity scholar at the VCU School of Medicine. I'm also the founder and president of VCU's chapter of Students for a National Health Program, the student branch of Physicians for a National Health Program. Before medical school, I worked in health policy on Medicaid expansion and financing, so I've seen our healthcare system from a few different angles, which has only reinforced to me the necessity of a single-payer system like Medicare for all. While the widespread American mythology says that private insurance is somehow more efficient than public, I've witnessed time and again how untrue that is. I currently have a patient who is medically cleared for discharge but has been sitting in the hospital for 2 weeks only because their insurance company is refusing to pay for their medically necessary inpatient rehab program. Shame. Meanwhile, that company spends 6 times as much of its budget on overhead costs as Medicare does, which maintains just 2% operating costs. So why are we wasting time and resources on this nonsense? I don't want to be a doctor to boost shareholder value for United Healthcare. I don't want my future career to be in a health system where I have to consider the whims of a profit-seeking insurance company in my clinical decision-making. Right. I don't want our increasingly corporate and consolidated health system to push even more rural hospitals out of business and strand rural communities like my hometown an hour away from the nearest hospital. I definitely don't want to be a patient in our current health system where no one my age has a primary care physician because it is impossible to find a provider who is nearby, who takes your insurance, and who can see you in a timely manner, even in the Virginia state capital where I live. Our current health system benefits nobody but the private companies it was designed to benefit. We can't afford to keep paying private insurance companies to rip us off, and single-payer healthcare is the only viable long-term solution to our current healthcare crisis. Thank you. In the wealthiest, most powerful country in the world, healthcare should be for everyone, and Medicare for all is the way to get there. Thank you all so much for your time and for your hard work fighting for what's right.
Our next speaker is Frankie Clark, who is a Medicaid patient. Frankie?
Hey. Good evening. Good evening. I'm here today. I am here from Charlotte, North Carolina, and I'm here on behalf of North Carolina Action, NC. I'm part of the Senior Warriors Network, and I'm here because of these guys. Popular democracy, all the above. I'm here. I am a patient. I'm the one they're talking about. I am what they're talking about. I am 80 years old.
All right.
Still here fighting. And so I'm fighting the good fight of justice and health care for all. I had mentioned that this country is one of the most wealthiest countries of all. I mean, we have money, we're powerful, we're wealthy. And yet, unlike our other countries, industrialized nations, civilized nations who have universal health care. So, America, I ask you, are you civilized? Think about that. And so I have health issues, even though I'm 80 and I take care of myself. I have glaucoma, it's an eye disease. And so as such, I have my insurance covers, thank God, dual complete. And so it covers, through Social Security, the Medicare covers somewhat. It needs some work. But thank God for it, because I remember before 1965 when Lyndon Johnson signed that bill into office, that Medicare that was part of Social Security. Prior to that time, the emergency room was your primary care. When you were poor and you had to decide, nobody had no money to go to the doctor, but you went. Thank you, ma'am. I know my time's about up. But I'm going to say this right here. You men in the Senate, I beseech you, have compassion and mercy on your fellow servants, those who are suffering. Think about it, could be your time. The tables could be turned. And someone is watching you.
Thank you, Frankie. Larry Stafford is also a patient. Larry?
So, as he said, I'm Larry Stafford Jr. I'm the executive director of Progressive Maryland. And also the vice chair. Oh, is Maryland in the house, by the way? I saw a few folks, so yeah, good to see y'all. But I'm also the vice chair of the People's Action Institute, and we are in full support of the movement for Medicare for all. And I'm here because this is not just an issue that is political for me. This is not something that our organizations fight for just because it's popular, even though it is. But because this is something that is near and dear to my life. So I'm here speaking for somebody who could not be here today because they are no longer with us. And I know we have a lot of people who are no longer with us, who are here today in spirit, fighting along with us. And one of those people is my dear aunt, Arlene, who happens to be the twin sister of my mother. And, you know, growing up, seeing them together, it was like having two mothers, right? Because they shared so much in common. They shared a common spirit, a common kindness, and so much, you know, that they would share together in an inseparable bond that makes twins. But as they grew up, you know, coming out of Portsmouth, Virginia, they grew up, they went in different paths. My mother got a job and in the military, was able to go and serve in our armed forces. And my aunt, she went a different path. For most of her life and her career working, she was working contract jobs, working jobs where she did not have any benefits, working jobs where she certainly did not have health care. And over time, my mother, she would always talk to her twin sister. You know, you couldn't get them off the phone with one another when they were talking. And she began to, talk about a pain that she was feeling in her arm, a pain that grew and turned into a swelling, a pain that grew throughout her body eventually. And her arm became so swollen that, my mother urged her to go and get this checked out. However, she never did because she did not have health insurance. And she actually feared going to the doctor because she feared what medical debt and the cost would do to her. She knew that she could not afford it. And unfortunately, by the time that she was able to go to a doctor and get checked out, it was too late. She was diagnosed with an advanced form of cancer, and she soon would pass away. But I'm here to say that my mother, she spoke to her before she passed, and she was comforted with her life and satisfied with what she was able to live, and she wasn't afraid. However, I as much as I admire that, I admire her faith and her courage, I cannot be as satisfied as she was, and we cannot be as comfortable going with this current situation that we have with our healthcare system. And that's why I'm glad to see you all standing here fighting for those who cannot fight any longer. Thank you so much.
Robert Wiseman is co-president of Public Citizen, one of the great nonprofits in this country. Robert?
Donald Trump, Robert Kennedy, congressional Republicans, they want to tear away Medicaid coverage from tens of millions of Americans to pay for tax cuts for rich people. Tear away coverage from tens of millions of Americans. No one wants this. 80% of Americans say they want Medicaid protected or expanded. No one wants to roll back drug price negotiations. 92% of Americans say we should do more drug price negotiation, but that's what they want to do. We are not going to let them. They are going to be defeated. They're going to be defeated by the people here and millions of Americans across the country who say absolutely not. But those millions of Americans who are going to defeat that effort, they do not want to protect this current system. They do not want to protect a system that leaves 1 in 4 people rationing their care, 1 in 3 people skipping medicines, 1/2 of debts due to medical problems that people can't pay for. People unable to get quality care, even if they've got coverage, have to wait too long. No one wants to protect this system. 2/3 of Americans agree we have a responsibility to make sure everybody has access to quality, affordable care. 70% of Americans want Medicare for all. And there are efforts around the country to make this happen. More than 100 cities and towns and counties across the country have passed resolutions calling for Medicare for all. It's happened in Atlanta, Indianapolis, Cleveland, Pittsburgh, Seattle, San Francisco, Tampa, Tucson, Knoxville, Tennessee, Denton, Texas, Kalamazoo, Michigan, Gainesville, Florida, Greensboro, North Carolina. Those resolutions don't just happen. They happen because people care, and they organize in their communities, and they go to their city councils and their mayors and their county executives. They say, do this. And those people listen because they too know that our system is failing. And as we build this movement across the country, we go from over 100 to many hundreds. We have lobbyists, not just those people, but now those elected officials lobbying Congress to finally do what should be done and deliver in this country Medicare for every single person, Medicare for all. There is a protective bubble over this Congress. There's one thing that can pierce through that protective bubble. That's when all of us organize. It's when all of us call our members, protest here, protest in there, tell them we're not going to let you listen to the drug companies. We're not going to let you listen to the insurance companies. We're not going to let you take care of the for-profit hospitals. You're going to take care of us. You're going to respond to your constituents. We are going to win Medicare for all. Thank you, brothers and sisters.
Last but not least, one of the great trade union leaders in this country, Mark Dimmenstein, president of the American Postal Workers Union. Mark?
It's great to be here with all of you in this fight for justice. And hats off to our elected representatives here who understood when they're voted into office by the people, they're here to serve the people. And it's really great to be here with our unionized nurses family fighting for as healthcare workers and providers, fighting for the good of the entire working people and people of this country. Congratulations. Look, postal workers know the value of affordable universal services, grounded in putting people over profits. That's what we do every day as postal workers. And that's the kind of health care system that every worker in this country deserves. I represent unionized postal workers who do have health insurance, but the APW is firmly and enthusiastically and unequivocally supporters of Medicare for all and single-payer health care. Our insurance, think about this, our insurance costs way too much. Up to $10,000 a year just in out-of-pocket premium expenses on the part of the worker. That doesn't count co-pays. It doesn't count other things. And our care is too often denied by the insurance company. So whether at the bargaining table or at the kitchen table, the cost of health care weighs on every working person in this country. And Medicare for all would set working people free from these out-of-control costs, claims denials, and free from the impossible choices that no worker should have to face. We'll be more free to organize a union without fear of losing our health care. We'll be more free to bargain for better wages from our employers. More free to change jobs and careers without losing health coverage. More free to withhold our labor and strike if needed, knowing our family won't lose their health care as we fight for a better future. Never should any worker have to choose between food and medicine, between keeping their home and a roof over their head or paying a hospital bill. Right now, postal workers are in the fight of our lives to save the public postal service and to save other essential and vital government services that are being slashed by the likes of the unelected billionaire President Elon Musk. But it is the same greedy Wall Street investors who want to destroy the People's Postal Service, who fight to maintain a criminal, profit-driven health care insurance system, all in the name of the almighty dollar. Medicare for all is what's right for workers, union and non-union alike, in the city and small towns, everyone in, nobody out. A commitment to serving everyone and alleviating the 99% of us the financial burden of enriching the for-profit and out-of-control health insurance industry. Health care should be and is a human right. It's long overdue for Medicare for all. Let's get it done. Solidarity.
All right, brothers and sisters, the struggle that we are engaged in is something that is supported by people all over this country. They are sick and tired, as we've heard today, of people dying, of people suffering because they can't afford to walk into a doctor's office or a nurse's office. That is not going to continue. The function of health care is quality care for every man, woman, and child, not huge profits for drug companies and insurance companies. The people are behind us. Let's go forward. Let's do it. Thank you all.